So the other day I went to see my family doctor, nothing too big, just something that I specifically wanted to get checked out. And it's really interesting. I haven't been to my family doctors in a long time. I don't really need to go, but obviously I needed something to get done. And it's just very interesting how different the approaches are with regards to actually treating problems, right? And so when I was talking to my doctor, he just did his regular stuff. And we were talking a lot about, the changes in my health and what has happened over the year, the increased amount of stress I was having. And I didn't really seek help for the mental and emotional part because I know that that's not really where you go. Family doctors are not the best for that. But it's just really interesting the approach of how very much symptom based it was where, truthfully, over the past few years, there has been, a weight gain on my part that I'm very much aware of. But the doctor pretty much just, gave me some tips and tricks like lifestyle and nutrition tips. And didn't really get to know exactly what had triggered the weight gain, right? And so it's really just interesting where I was just kind of there listening and I'm like I mean I was there just sitting and really felt that I wasn't listened to. Now I don't really have any big complaints with regards to this doctor. He has helped me so many times, but it's just very interesting when you see this kind of approach being on the patient side. And I know very well, having a nursing background, exactly what I've done, and so that's why I went. And it's just interesting how what I really truly needed wasn't addressed. And of course, this really isn't a flaw of this doctor in general. It's just pretty much how us medical practitioners were trained, right? We weren't fully trained to see things more holistically. We were trained to treat symptoms. And for sure, that's exactly what my training was. Like there was a little bit of holisticness, but it was mostly self-directed thing that I did for myself. But mostly in the medical and even in the nursing profession, it's very much symptom based, which is very important. I'm not negating it. I used to be an emergency room nurse, so a lot of the things we did were life saving. But at the same time, there are a lot of things that we can do to prevent the emergencies from happening, right? We can do a lot more with regards to overall societal education with regards to what actually causes things like hypertension that causes coronary artery disease, which eventually leads to like an MI or heart attack, right? There's a lot of education and lifestyle practices and things that we can do for ourselves on the daily to prevent these emergencies or these things from happening. And so obviously I'm more always actually, even as a nurse, have been more interested in the root cause type thing because traditional Western approach just doesn't really suit very well for me. And being the patient in a regular Westernized approach was something that I completely didn't like or appreciate. So I just wanted to talk to you about this because it really made me think a lot about, I am a person who knows exactly what is going on internally. But at the same time, I felt kind of I guess sad for people who do go to traditional Western practitioners and they're not given the actual things that they need to be doing on a daily basis and are given pretty much what's the word, old, outdated treatments or techniques to help them with their health. And this is exactly why I'm just so passionate about kind of root cause treatment, psychologically and of course holistically for your health. Because and this is why I'm so passionate about learning about the subconscious mind and our bodies in general and putting together the things that I have learned in the science world, as well as the psychology stuff that I'm doing with now with hypnosis, because it's when we have this holistic approach, we can definitely not only improve our mental, emotional, physical, spiritual health, but also at the same time, we are more than capable and more than likely to make massive impact if we do prioritize ourselves and know what is going on internally, especially especially when it comes to our psychology, our minds, how we perceive things, how we behave. Because once we master um, our inner, like our inner self, once we become more self-aware, and we can always get more self-aware every day, then the power that we have is going to be tremendous. And so, sharing this with you today to gain, two different perspectives. I did get exactly what I needed for my family doctor, but at the same time, now I get to do the work in determining what works best for me based on what I know. So, what are your thoughts on that? I would love to hear about it. Definitely let me know. Otherwise, I will see you next time.